Hello, in this video we are going to discuss the sign and symptoms of the heart failure. Now you know that heart failure means that when your heart is unable to meet the demand of the body, like when your heart is unable to pump out blood. So less blood will be pumped out and that less blood will not meet the demand of your body. So this is what called heart failure. Heart failure can be left-sided or right-sided. Now left-sided heart failure. Now when the left side is predominantly involved, so this is called the left-sided. Now the clinical effects of the left-sided heart failure arise from the diminished systemic perfusion, like the organ which is not receiving enough blood, the signs and symptoms of their organ will be appear, and most importantly elevated back pressures. Now what does this means? Now, when your left ventricle is unable to pump out blood, the blood will accumulate in the left ventricle. Now, more and more blood is coming to the left ventricle, so that will accumulate here. They will also accumulate here. Now, when your heart is unable to pump out blood, this will automatically accumulate here in the ventricles, auricles, also in the pulmonary circulation. This is like a common sense. Now, when the blood accumulates in the pulmonary veins, this is called congestion. Congestion is actually the accumulation of blood. So when this blood accumulate here, they will also accumulate here in the lungs, like in the lungs capillaries. Now when the blood volume increased or congestion occur, the capillary hydrostatic pressure will rise. Now when the capillary hydrostatic pressure rise, it will diffuse the fluid from the vessels into the interstitium. Now when the fluid diffuse into the interstitium, it can also diffuse into the alveoli, and this fluid can accumulate in the alveoli, and which is called the pulmonary edema or the pulmonary congestion. And this edema or this fluid in the alveoli can impair the oxygen diffuse, which can cause various signs and symptoms like the dyspnea. So the shortness of breath will occur, which is called dyspnea. Okay, orthopnea will also occur. Orthopnea is when the patient lie flat, the blood will move from the lower side to the upper, toward the heart, this blood will also come toward the lungs. So they will further increase the hydrostatic pressure, which will cause which will increase the pulmonary edema, and the dyspnea will occur. So when the dyspnea occur on lying flat, this is called orthopnea. The cough will also occur. This fluid act as a foreign material, so cough reflex will activate. Wheezing can also occur. Anxiety, restlessness will also occur. Cyanosis will also occur because the oxygen diffusion is impaired, so bluish will occur. Okay, the profuse sweating will also occur because when this occur, the body stimulate the sympathetic nervous system, which cause the sweating, increase heart rate, and elevated the blood pressure. So the symptoms of left-sided heart failure will be dyspnea due to the pulmonary edema or the congestion, cough, orthopnea, worse when lying flat, relieved with sitting up or standing. So when orthopnea occurs, the patient is asked to sit up or stand. So this will push the fluid toward the lower body due to gravity. Paroxysmal nocturnal dyspnea. This occurs when the patient lay down during the sleep. The fluid will go from the lower side toward the heart, and this will worsen the dyspnea. So when dyspnea occurs during the sleep and the patient wake up due to dyspnea, this is called the paroxysmal nocturnal dyspnea. And orthopnea occurs whenever the patient lie flat. Okay, and this occurs during sleep. Now what are the signs of the left-sided heart failure? Cardiomegaly. The cardiomegaly occurs because the fluid accumulate in the heart, so the heart will enlarge, and there is also hypertrophic cardiomyopathy. These all can cause cardiomegaly. Now when you see the chest x-ray of the cardiomegaly, normally the thoracic ratio is less than 50. When it is greater than 50, it will be a cardiomegaly. Like you see here, it is the cardiac diameter, and this is the thoracic diameter. Okay. Now how these uh, signs appear. Now when the hydrostatic pressure increase, as I previously discussed, the fluid will diffuse from the vessel into the interstitium. Okay. Now here you see this is the parietal pleura and this is the visceral pleura, and here normally there is very less fluid, but due to this mechanism the fluid will accumulate here in between the visceral and the parietal pleura, which is called the pleural effusion. Now when the fluid accumulate here, various sign and symptom will be appear, like on the chest x-ray, the pleural effusion will appear like this opacity will be shown, like you see. Okay? And this meniscus sign is also present, so this shows the pleural effusion on the chest x-ray. And these sign and symptom will be occur because of the pleural effusion, like there will be decreased breath sounds because there is the fluid in the pleura and the alveoli, so breath sound will be decreased. When you percuss the chest, you will feel the dullness. Normally the percussion is resonant, but here dullness will occur. There will be decreased chest expansion, and the trachea deviation will be occur up to the opposite side when there is very large pleural effusion. Pleural rub will also occur due to the friction between the two pleura. Tactile fremitus is the vibration which will be decreased when you place the hand on the chest. The vibrations will be decreased, the sounds vibration will be decreased. So when you auscultate the lung bases, you will hear the crackle sound. It is like when you walk on the road and leaves, that sound is a crackle. It is due to fluid spilling into the alveoli. Okay. Now the dullness will be occur, decreased tactile fremitus will occur. Okay, due to pleural effusion, as I already discussed. And there will be increased intensity of the pulmonic component of the second heart sound. So second heart sound consists of the pulmonic wall and the aortic wall. So the pulmonic wall will be intensity will be increased because there will be more blood in the pulmonary artery. Now pathological S2 and S3 and S4 heart sound will also occur in the left-sided heart failure. Now what are the S3 and S4 heart sounds? These are the abnormal sound. In these abnormal sounds are called gallop. Gallop means the galloping heart, the sound produced by the when the horse run very fast. That is the gallop. So they appear like a gallop. Now how the S3 sound is produced? What is the mechanism? Normally when the mitral valve open, the blood is rushed into the ventricle, but during the heart failure there is also some blood during the diastole. So when the mitral valve open, the blood rush into the left ventricle, and that will fill the left ventricle very soon, and so there will be the abrupt cessation of the rapid filling. So when this rapid filling is abruptly stopped, this will vibrate the ventricular wall, and this vibration will be heard as the S3 heart sound. Okay, so this occur during abrupt cessation of the rapid filling of the left ventricle, and they occur during the early diastole, like when the mitral valve open, blood suddenly rushed into the left ventricle, and this sudden left ventricular filling does not need the atrial systole. They occur by itself, like they occur passively. Okay. Now the sound is occur just after the S2, and it will be heard like a Kentucky. Now the S3 sound is low pitched, and it is heart based at the apex with the bill of the state, and it can be physiological in the young patient, children, and during the pregnancy, but it is always pathological in the heart failure and mitral regurg. Now, how the S4 sound is produced? S4 normally occur when the ventricle is very stiff, like the hypertrophic cardiomyopathy, restricted cardiomyopathy. The left ventricle is very stiff; it does not relax. So, when normally the mitral valve open, the blood will rush. But during the second phase of the filling, like during the atrial systole, there are two phases of the ventricular filling. One is early filling, and one is late filling, and this occur during the atrial contraction, atrial systole. The blood with the help of atrial contraction move from the left atrium into the left ventricle, but due to the restricted, due to the stiff ventricle, the blood will not be pushed easily, and the left auricle has to work very hard. Okay, so this forceful contraction of the left atrium will produce the vibration, and that vibration will be heard as the S4 heart sound. So this normally occur at the end of the systole, and this occur during the early diastole. Now this S4 occur just before the S1, like at the end of diastole, there will be after the diastole, there will the mitral valve will close, so they will produce S1. So S4 occur just before the S1. Okay, and they will be heard as a Tennessee. They are also low pitched. Okay, and they are heard best at the left sternal border with the bill. They are normally absent in the atrial fibrillation, and a feature of very severe left ventricular hypertrophy, as I already discussed. Now here you see the S3 occur just after the S2. Okay, now when the aortic valve close, the mitral valve will open. When the mitral valve open, just after that, in the early diastole, S3 will be heard. Okay, and S4 occur just before the S1. Okay, now what is the right sided heart failure? It is when the right side of the heart is mainly compromised. Okay, and it is the most common cause of the right side heart failure is the left sided. When the left side is compromised, blood will accumulate here, and up to the this will also decrease the right ventricular cardiac output, which can cause the right sided heart failure. Okay, now what are the signs and symptoms? Normally, when the right ventricle is compromised, the cardiac output of the right ventricle will be also compromised. Okay, so blood will accumulate here in the right ventricle. They will also accumulate here in the left atria, and they will also accumulate here in this systemic circulation. So congestion will occur in the systemic circulation, and they will increase the hydrostatic pressure of the vessel. It is actually the hydrostatic pressure, not interstitial pressure. Okay, and the fluid will move from the vessel into the interstitium, so they will cause the peripheral edema. Like fluid will move out of the vessel, so they will cause the edema, peripheral petting edema, like here you see. They will also cause the jugular venous distension. You see, the blood will be pushed back into the jugular veins, so they will distended. Hepatomegaly will also occur. So when the back of pressure increase, the fluid will accumulate in the venous system. They will also accumulate in the hepatic vein, and they will cause the hepatomegaly. Hepatojugular reflex will also occur, like when you palpate on the liver, they will cause distension of the jugular vein. Okay, so this is called the hepatojugular reflex. Right ventricular hue will occur During the right-sided heart failure, the right ventricle become hypertrophic. They become enlarged. So when you palpate on the left of the sternum, you will feel the pulsation of the right ventricle, which is called the heave. So this will occur. And next is the ascites. Ascites is the accumulation of the fluid in the abdomen. So this will also occur. Here is the difference between the right and left-sided heart failure. You see, raised GVP occur in the right side, hepatomegaly, ascites, and the pitting edema also occur in the right sided. But in the left sided will occur the pulmonary edema. They will occur in the left sided. Okay, and also pleural effusion. And because the left sided can cause right side hypertrophy, so you will also see pitting edema and raised GVP. Now, heart failure can also be acute or chronic. Acute mean when the heart failure occur very suddenly. Okay, so there will be sudden pulmonary edema occur, and there will be acute respiratory distress and orthopnea. And mostly MI can cause sudden acute heart failure. Okay, chronic occur when there is some problem in the heart, like the valvular heart disease, like the aortic stenosis. So heart failure will develop gradually. It will take a very long time. So there will be relapsing and rheumatic course with periods of stability and episodes of decompensation. Okay. Now, heart failure is classified by the New York Heart Association into 4 classes. Class 1 states that the symptoms will occur only with vigorous activities like playing a sport, and there will be no limitation of the normal or ordinary activity. And class 2 states that the symptoms will occur with prolonged or moderate exertion, such as the climbing a flight of stairs or carrying heavy packages, and there will be slight limitation. Okay, slight. Class 3 states that symptoms will occur with the usual activities of daily living, such as walking across the room or getting stressed, and there will be marked limitation of the normal activities. Okay, and class 4 states that the symptoms will occur at the rest, and there will be very marked limitation, like unable to undertake physical activities without symptoms. So this is very important for the exam point of view. Many MCQs can come over this table, so it is very important to memorize. So this was all about the sign and symptom. In the next video we will discuss the investigation and treatment of the heart failure. Thank you.